This is an important video. I sent out an email to my Patreon subscribers. I picked up another COVID patient that joined the Patreon so that they could email me. And I've already responded to 2 or 3 emails from people just today that are following a protocol. We're going to interview some people, hopefully over the phone, in the next couple days that have been in healthcare, that have had symptoms, or just want to get their take. And I want to tell you what happened to me today. I am so mad. I am so upset. I am so disgusted that it's just so hard to stay professional. Now, I'm not a journalist. I'm just a human being that loves research, and that it was fortunate to have a family that's just maniacs about science. And so, of course, when I went to school and went to college, of course, I took a lot of the biological sciences. But, you still got to take electives, so, physics, astronomy, all those, I loved all those classes. And I went to a Walmart today. And I've never been to this Walmart. It's near an Indian reservation where they have a high rate of transmission going on there, higher than anywhere else in the state. So I consider this Walmart high risk. So I covered my shoes. I wore a rated mask. I even put silver on it. I had hand barriers for my hands. And I ran out of gloves, so I'm wearing like baggies on my hands, right? I don't care. I'm not proud. So I'm going to Walmart, and I'm going through the cashier line. Most of the cashiers are wearing gloves and masks, and my cashier has no gloves on. And I watched the 2 people in front of me hand her cash. She handed cash, she made change, and she didn't wash her hands. She didn't use sanitizer. She got to me, and I asked her. I said, "Do you have hand sanitizer?" She said, "Yeah." And I said, "You don't mind using it before you touch all my food, do you, please?" And she goes, "No." And she reaches in her pocket, pulls out a half-ounce bottle. A personal bottle. The store, Walmart, doesn't provide their employees with bottles of sanitizer. And so I asked her, I said, if you wore gloves, you could bathe in that stuff and never hurt your hands. She goes, "Oh, well, the gloves are too big. They're, it makes it harder to do my job." And I said, "That's no excuse. I'm in healthcare. That's no excuse. Have you noticed the whole world is locked down and there's a bunch of elderly people in this store? By handling that guy's cash and handling these people's groceries, you could kill somebody today. But it's also about protecting yourself," I told her. So I'm not happy because I'm tired of going into, and not every grocery store is like this, but I'm tired of going and seeing cashiers handling money and then touching food. Food! Sorry, excuse me. It's just absurd. It's so absurd. And the reason why it's absurd, people, and if you find out I'm wrong, unsub me. Get rid of me. But I'm going to tell you something, being in healthcare. The AMA, the National Nurses Association, every state nursing agency, every state and county health department, the National Institute of Health, the World Health Organization, the Center for Disease Control, the AMA itself, all have written documents, written statements, written publications, every single one, stating that hand contact is the primary mode of transmission of respiratory viruses, stomach flu, and, of course, multiple resistant bacteria. The number one mode of transmission. So if you're taking precautions and wearing a mask, which isn't the number one mode of transmission, you're wearing a mask and not gloves, and you're not washing your hands when you touch a bunch of stuff, you're grabbing doorknobs with your bare hand and going shopping, you're ignoring, and the officials, the White House, the Center for Disease Control, they're all ignoring that what they have already published. Hand contact is the #1 mode of transmission of these diseases. And it's easy to understand when you just go to a grocery store. Now, I've only been sick twice in 5 years. I only got a cold twice, or was exposed to a cold twice. And of course, I put it down. But the only reason I got sick is I went to a grocery store. And I got sick going to a grocery store. And I know it was a grocery store because I'm living in hiding, I've been in the hospital too many times. I've got too many threats. So I don't just go driving around in public and hanging out. And so the one time I go to a grocery store, what did I do? I opened up a carton of milk on the way home. I was thirsty and hungry at the same time. And I put the carton up to my mouth because I was living by myself at the time, so nobody's drinking from the carton. And I took a swig, but my nose touched the carton, and I inhaled. And within 12 hours, I had a scratchy throat. And I knew exactly how I got it. So that's why I tell people, be careful of the cartons that are in the refrigerated section. Because people put their hands on it, and because of the cool atmosphere, the moisture condenses, and you can keep things alive on the milk cartons and stuff like that. But so now I'm done with this cashier. She tells me the gloves are too big. That's why she's not wearing them, and I'm saying that's too bad. I go, look at my hands. I'm wearing baggies, lady. I'm wearing baggies to protect you. So when I hand you my cash, you know that I haven't been fondling it with my nose picker hands. And so I expect the same from you. If you handle cash, I expect you to protect me. And there's a bunch of elderly. So I went to the customer service. I asked to see the manager. Well, why do you want to see the manager? I said, I'm in healthcare. I have some concerns. I need to talk to your manager. This is important. The whole world is locked down. Well, if you're not going to tell us what you want to see the manager for, we're not calling him. And I'm like, why, you little boy, Walmart, huh? Walmart. So I'm like, well, I want to talk to the manager. So either I'm going to go through the store and start asking every employee where the manager is, or you're going to call him. She goes, nope, I'm not calling him. I go, okay. Plan B. Pulled out my cell phone, walked over to the cashier with no gloves, and filmed her hands while she was doing a transaction. The lady comes up to me and goes, you're not supposed to be filming. I go, you're filming me? I didn't read a law or an article in the Constitution that says filming is illegal. So she goes, no, it's a store policy. You can't film in here. I go, well, I'm filming in here. And I'm not filming people. I'm just filming their hands. What did she do? She got on her microphone and called the manager for me. That manager there was so quick. That's the quickest I ever got a manager in my life. His name was Mike. He was overweight, and he was wearing a mask. And I told him how upset I was that there's a bunch of elderly. You're right next to an Indian reservation, and you're high risk. There's a lot of people in this store, and you're allowing people to handle cash and go from cash to my food without wearing gloves and without sterilizing their hands. And you know what he said? Well, if you don't like it, you don't have to come shop here. And boy, I took one giant step into his face. And I gave him the look of death, and he stepped back. He said, please stay 6 feet away. I said, well, if it's okay for you to smear your hands all over my food, screw your 6 foot distancing. Screw it. You're wearing a mask. I'm wearing a mask. What are you afraid of? And boy, I put him to the test. I said, do you even care? Do you even care? The elderly walking around and you got people handling some of the most dirtiest things on the planet, which is cash, and then touching their food? You think that's okay? Have you not noticed the whole world is freaking locked down? The economy is put into shambles over this virus, and you think it's okay to run 1,000 people through your store and have your cashiers touch cash and touch their stuff? I go, you must be trying to get people sick. Your cashier could have killed 3 people already today. 4 people, 5. Who knows how many people you killed today? And so he just was like shrugging his shoulder. Too bad, What are you going to do about it? So I told him. I said, I will be back. I won't be back shopping. I said, but when I come back, I will not be alone. And he goes, is that a threat? I go, no, that's not a threat. I'm promising you, Mike. I'm promising you. Hey, Mike, have you read the law about self-defense? He goes, what do you mean? I said, self-defense. If somebody's going to hurt me or harm me or hurt somebody else or harm somebody else, I have a legal obligation and a social responsibility to take whatever measures I deem necessary to prevent that injury and to prevent people from getting hurt. I go, Mike, it's self-defense. Do I have to defend myself from you and your store when I go shopping here? Who's going to defend that 80-year-old lady right there pushing that cart? Are you? Hell no. So anyways, I get escorted out of the store by security. I got it all on my cell phone, And I'm outside talking to a lady. And she tells me that she was working at the Walmart that was 90 miles away, the one that I, usually go to because my bank is there. And I've gone there twice in 2 months, once a month. And I said, the first person to get sick in that little town 90 miles away was a cashier at Walmart. And she says, I knew that lady. She used past tense. She says, I knew her. And so I talked. I found out that they didn't even get gloves till that week. Walmart wasn't even protecting their own cashiers. And they were required to get their own personal sanitizer. They did not provide sanitizer for their employees. There should be a hand sanitizer at every cash register. Instead, they have these half-ounce things they want to make last all week long. They should be dripping and drowning their gloves in that hand sanitizer. And so I'm talking to this lady. She says, yeah, well, I'm a cashier. I try to wear gloves, but after 2 months, I just seem like I don't care anymore. And I said, well, there's a law. There's an order. You have to care. You could kill people. You gotta, just because you don't see it doesn't mean it's not happening. You could kill somebody by handling cash and then handling their food. And she's wearing a mask. She's outside. She's spraying down cart. She says, well, to tell you the truth, it feels great to get out from behind the register and not have to deal with all of that. And then so I found out Walmart did not supply their employees with gloves for an entire month and a half to 2 months during this pandemic thing. They did not provide them with hand sanitizer. And they did not require them to use any of it between cash transactions. So she said, well, what you could do, and she was trying to whisper through her mask, you could file a complaint with OSHA. And I said, well, OSHA doesn't even have a statute for infectious diseases. But I said, I'll write a letter, and I will write a letter to the health department. But I will be making a video. It will be going public. So I'm begging you. 1,000 more people go through Walmart than they do usually through one of your grocery chains. If you have a grocery chain that sees less people per day, you're automatically going to have lower exposures. Just because of the numbers. But then a lot of those people, it's a complete grocery store. Walmart is everything. It's dry goods, it's furniture, it's whatever. That electronics and food. But the grocery stores are food, 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 and so they take their stuff pretty seriously. And standing out in front of the store counting, it's like, well, if you go one over your limit, somebody's going to die. There's no limit. There's no magic number on how many people you let in your store that's going to prevent people from touching a doorknob or a handle on a freezer or a refrigerated case. So I'm encouraging you. I'm begging you. I'm pleading with you. Share this video everywhere. Social media. Get it out there. We need to send a message. We got to start standing up to this nonsense. It's insanity to wreck your economy, to force people and violate their First Amendment rights over a virus, and then when they go to the store, cross-infection is just... There's no precautions. And everybody's acting like this thing is only airborne. It's not. It's the number one form of disease transmission is hand contact. Period. We need to boycott. You need to boycott. We have to boycott Walmart. Let's get it out there. Get it out there now. And I guarantee you, if you share this with 10 people and they, you encourage them, 10 people, 10, I guarantee you in 48 hours to 72 hours, every single cashier in Walmart is going to have hand sanitizer, and they're going to be wearing gloves. And you would have saved countless grief. Even if people don't die from this, getting sick is no fun. We have to boycott Walmart. And the power of the boycott is massive if people go along with it. Let's look at an unintentional boycott. Let's look at what that has done. Because of the stay-at-home, shelter-in-place order, which we all knew was coming. And it's going to get more authoritarian. You just wait. And if it's not this pandemic, it'll be the next year's pandemic. But the bottom line is this. We are not driving. We are not using gas. The gas refineries are full. They have nowhere to send their gas. So guess what's happening? Off the coast of Texas, Louisiana, there are oil tankers that are parked in the ocean. And that line of oil tankers extends to the horizon because they're waiting to offload their oil. And the price of oil is crashing. And the price of gasoline is crashing. So we as a people, if we act together, we are like the most powerful entity on the planet and in the universe. But divided, apathetic, nonchalant, disconnected, we're helpless. So if you wanted to bring the price of gas down, I mean, that really helps the economy, when the price of energy comes down, everybody makes a little more money, everybody spends a little less money. It sure is nice that when you go to fill up your tank to spend $35 instead of $65. At the end of the year, that's a lot of money in your pocket. We can affect that just by cutting out 60 miles a week out of our driving, by carpooling, by getting cars that are a little more efficient in their gas usage. And we could have brought the gas prices down a long time ago. But this is a great example right now, happening right before your eyes. The power of boycott, the power of us. So let us take the bull by the horns. Let us take matters into our own hands, because we have to. Let us be the driving force behind what policies are being pushed and what policies are not. Let us be the reason we're doing it. Let's do it for us. Boycott Walmart. Share this video. Share it with 10 people. Tell them to share it with 10 people. It is absolutely going to save lives. Now, one last thing about the coronavirus. A lot of people say it's a hoax. A lot of people say it's a scandemic. I saw that term, a scamdemic. I like it. But we know there's a real virus out there. There's independent studies being done by non-globalist countries that have studied this virus, found insert proteins that have never been found on a coronavirus ever before. And we have people sitting in jail right now selling secrets to Wuhan Institute itself, biochemical secrets. And Dr. Linder from Harvard, I believe he had his own office at Wuhan. Wuhan is, there's other people from Wuhan have been arrested. Some people, there's warrants out for their arrest, but they've left the country. So there's a paper trail that leads all the way across the Pacific Ocean right to Wuhan itself. Not to China, but to Wuhan. So there's a paper trail there. And when somebody that manufactures bioweapons and has a contract with the Defense Department, sitting in jail for selling secrets and being on a payroll for Wuhan, and then Wuhan has this outbreak, you really think this is caused by an animal? And the one thing that we really I wanted to share with you is in October and November there were some really sick people. Entire families got sick, and I know my landlord was on her deathbed. They thought she was going to die. Her cardiac output was 30%. They put a shock vest on her, sent her home, and she had to be around somebody 24 hours a day so that when she died, they can dial 911, and that shock vest would automatically shock her heart. So she's wearing a battery, and she's sleeping in it. But she made a full recovery, it looks like. But they tested her for SARS. They tested her for MERS. They tested her for influenza. The doctors said, we don't know what this is. We don't know what it is. So, and then another friend in a nearby city wasn't so lucky. His father caught the disease and died. He caught it and was sick for 3 weeks. Had bronchitis for 2 months. So they think they had it. He got his doctor sick. His doctor said she thinks it was COVID. So I know people in healthcare that can't go to work. I know people that in healthcare that were sick and couldn't get a test. Maybe now they can. So this is a real virus. It's a engineered virus. But I said early on that I think this virus probably has a fast burnout rate. And that if it's a bioweapon, they already have an antidote or a vaccine for it. Basically, you're not allowed to make a biological weapon, even by the Pentagon standards, without having an antidote. So anyways, I hope you learned something. Let's boycott Walmart. You have to share this video. Please. Let's save some lives. Let's do it for us.